You may be the best player on the court, but it's hard to score without a team. Together is better. Why do this when you can have this?
It just wouldn't be enough. Oh no, I just can't praise him enough.
Sure, one voice sounds good,
I just can't praise him enough. I just can't praise him enough. Thank you, Lord.
but many voices sound, well, heavenly.
1, 2, 3.
People working together make things happen. Many hands make light work. More ideas mean more solutions. Lots of participation means lots of success. The same is true when it comes to fighting disease in our communities. More makes sense. They can't do it alone. It takes all of us. Friends, neighbors, communities, partners. It's like that rock you throw in water. As it lands, it sends out ripples, waves that reach out farther and farther, on and on, in ever-expanding circles. It works the same with people. One person with something to say, a good idea, a way to improve the neighborhood, can make a big difference, especially when it comes to tuberculosis. One person reaches out, and then another, and pretty soon you have a community working together to stop TB.
Tuberculosis, or TB, is an infectious disease. It's a classic public health disease in that one single person's illness can impact an entire community. TB disproportionately afflicts African Americans in the Southeast. For example, in North Carolina, somewhere in the ballpark of 2/3 of our TB cases are African American, whereas our population down here is under 20% African American. Communities can partner with the public health system in order to get the people who are at risk tested and treated for tuberculosis.
Tuberculosis is spread through the air from one person to another. The TB germs are passed when a person sick with TB disease sings, coughs, laughs, or sneezes. If you can breathe, you can get TB. This can happen any place where people are close together. In church, the choir, school, jail, family dinner, homeless shelter, or at work. You can't get TB from someone's drinking glass, clothes, handshake, or toilet. And it's not a virus like AIDS. It's bacterial and mostly spread through the air. Once breathed in, the TB germs can grow in the lungs, but may also spread to other parts of the body, like the kidneys, spine, and brain. Symptoms of TB in the lungs may include a bad cough for more than 3 weeks, pain in the chest, coughing up blood or sputum, weight loss, fatigue, chills, fever, weakness, and sweating at night. Healthcare professionals use a simple test to figure out if a person has TB. The bad news is TB can kill you. The good news is treatment cures TB. The key is to make sure people get treatment and stick with it until cured. In fact, though TB is on the decline, it still shows up in our communities. In 2006, there were nearly 14,000 cases, a relatively large number of them among African Americans. We see differences in the success with stopping TB. Some communities are close to eliminating it, but others have a ways to go. TB is still a problem in the African American community, with TB rates several times higher than in some other communities. That's why it's important to stop TB. But you can't stop what you don't know about. When it comes to TB, what you don't know can hurt you and your community. It's a lot like other community action, whether you're improving the schools, making neighborhoods safe, or stopping TB. It all begins with talking, building awareness.
Well, I think the secret to control of TB is communication, educating people about TB and the symptoms of TB and the fact that TB can in fact be effectively treated. We're fortunate. We're talking about a disease that can be effectively treated and controlled. That can only happen if we know who has TB. So communities need to communicate about TB. They need to collaborate if we're going to control it. As soon as we take our eye off the ball of tuberculosis, it can increase again. We run the risk of another major outbreak of tuberculosis.
When it comes to stopping TB, the first step is partnership. And a good place to start is the health department.
And so we need communities to help us get the word out that, hey, we can provide those services. If you're at risk for TB, if you suspect that you have TB, we can provide those services. So we need the community to help us with that piece of it. From the community perspective, it really is to prevent and to begin to process the elimination of tuberculosis.
What the community brings to it is an understanding of the cultural norms of a community, what works and what doesn't work, so to speak. They know the history of the people that live in that community and how they see their world. They can have a very cohesive and harmonious union.
When I was director of CDC in the early to mid-90s, New York City had a major outbreak of tuberculosis. We invested a lot of resources in controlling that outbreak because TB is an infectious disease, so if it's at one place in the country, if you don't control it there, it spreads to other places. So the community needs to know that government is critical when you're dealing with a major problem that can affect the entire population.
When communities come together to promote public health or education or any common good, then you get improved quality of life for everyone in the community. And you can see very clearly that the efforts to control TB in the United States have improved the quality of life for people in the United States. Many people in the U.S. are not aware that we have TB anymore because our efforts have been pretty successful at reducing the number of cases. And it's a lot of human misery that we have eliminated by coming together as a community.
Well, you know, it's really being in the community too, and in terms of getting and sitting around the table with community leaders and letting them know what you have to offer, but yet at the same time, listen to them, listen to what they have to offer, listen to what they want to see happen in their communities. So it's extremely important that trust be established very early on, and that everyone feel like they have something to offer to the effort.
Every community is unique, but the one thing they all have in common is a health department, ready to support community efforts to be healthy, happy, and strong. We can't do this alone, but neither can they. But when you bring people together, something good is going to happen for the community. It's a partnership that works.
Health departments are, in fact, a part of the community. They're funded by the community, directly or indirectly, and therefore it's critical that health department work with communities. But it is impossible to control a problem like HIV/AIDS or tuberculosis without community involvement and action. We have to mobilize communities.
We've learned some things throughout the years about what works and how we help mobilize communities to partner with the health department. And when you see strong relationships between the health department and community, you usually find leadership in the health department that is very inclusive and open to getting community input.
The efforts to stop TB will look different for each community because each community is different, absolutely unique. What works here may not work here. The key, though, is to work together. Your efforts will be homegrown. That's why it's going to work, because you design it for your community, urban or rural, small town or large city. Whatever your group chooses to do, holding meetings, setting up community action groups, or getting together with the health department, the most important thing to do is begin talking about education, screening, and testing. All it takes is that first person stepping forward to make a difference. That's how most great changes begin. Your efforts can be a part of something already going on in your community. A school task force or health coalition, a neighborhood watch group or church committee. Whatever works best for you and your community. Best of all, the tools are there. All you have to do is add people and energy. TB is here, but so are you. It's up to all of us to learn the facts, get the word out, make a difference. Education leads to diagnosis, which leads to treatment, which works for everyone. Together we decide what works best in our communities, for our communities.
They can't do it on their own. There's not enough manpower to do the job. This is a community issue. They need help from the community. And so the community has to recognize that.
The bottom line is that public health is nothing without that public part. And we really are most effective when we have community buy-in to what we're doing. We're really treating the communities. And like any doctor-patient relationship, the patient, in this case the community, has to be an active partner in that relationship in order to make it most effective.
It's about people living and living healthy lives. People that go to work and they go to work healthy. That means that they're less likely to take off of work. They're more productive. They're happier. They take care of their families.
People still die every year from TB. So working together, we can get the word out, and more people will be more likely, more inclined to go and be tested for TB. And that's what we want individuals to be able to get in at an early stage so that they can go on and live a normal, healthy life.
The more people we have involved, the more resources we can bring to bear upon any given problem. And the more resources we bring to bear, almost invariably, the earlier we're going to get on top of the problem and control it.
We live in a world of connections and influences, actions and reactions. One small change can affect everything. This is especially true in communities. What happens here can make waves here.
Partnerships have been part of the development of a lot of the processes. So the partnerships came together and say, these are some things that we feel like would fit better in our community. So what they brought was, hey, things that we feel comfortable with, things we see, things we don't like to see, and be able to add that.
Well, there are some problems that can only be controlled when communities work together. So communities have to be aware, but they have to communicate that awareness to each other, and then communities have to develop collaborations among the various institutions within a community.
It's just about coming to the table. How do we really address health concerns as one body of people that have really more in common than we have differences?